Hi, my name is Aixa Soyano. I'm a breast medical oncologist and an assistant member in the breast department at Moffitt Cancer Center in Tampa, Florida. So today we presented some of the updates from ASCO for the early stage breast cancer trials. So the first trial that we updated was the Luminal A, which is a trial omitting adjuvant radiation in women with low risk Luminal A, ER positive, clinical T1 and 0 breast cancers, in which they had very low rates of local regional recurrence, so something that we can consider for some of these patients. After that, we presented the trial, the ASTR-70s trial. So this particular trial was in a geriatric population, so 70 years or older, ER positive, HER2 negative breast cancers with any tumor size, any nodal status, using a genomic profile called the GGI index. So those patients that had high GGI were randomized to receive endocrine therapy or chemotherapy followed by endocrine therapy. And in that particular trial, in the intention to treat population, there was no benefit of adding the chemotherapy regimen to that population. But in the per protocol population, there was a small statistical benefit. So the debate is out there, but it demonstrated a good collaboration among several centers in this geriatric population, so more data will come out of that. The other trial that we presented was the ASTR trial, and this was the 8-year follow-up data in premenopausal women that remain premenopausal after chemotherapy for ER positive tumors, and they received tamoxifen or tamoxifen plus ovarian suppression. And the authors concluded at the 8-year mark that there was still improvement in disease-free survival compared to so there was improvement in disease-free survival at 8 years in the ovarian suppression plus tamoxifen group, but there was no overall survival benefit in this population. And lastly, we presented the 8-year follow-up of the ABCSG18 trial. So in this particular trial, the trial randomized over 3,000 women to receive denosumab or placebo. These women were postmenopausal ER positive tumors. So the last trial that we presented was the ABCSG18 trial. So in this particular trial, they enrolled postmenopausal women with ER positive tumors that were receiving an aromatase inhibitor, either an anastrozole or letrozole, and they were randomized to receive denosumab or placebo. In this particular trial, we knew that there was decreased time to fracture from previous publications, but they presented the overall long-term outcome. So at median follow-up of 8 years, there was improvement in disease-free survival, bone metastases-free survival, and overall survival in the women that received denosumab compared to the women that received placebo, suggesting that we should consider strongly this for our postmenopausal patients on AI therapy.